Even as the stakes for succeeding in education get higher and higher every year, we're still choosing a mode of teaching that we know only works well for a minority of our children, and it's killing us. It's time to start talking about the most revolutionary option on the table: unleashing our superpower.
Nothing, absolutely nothing, approaches the effectiveness of tutoring.
It would be really hard to find an educational intervention that has the same rigorous research base and potential to improve student outcomes as tutoring does.
Tutoring, lots and lots of tutoring. That is going to put them way, way ahead.
Welcome to Tutoring the Human Superpower. I'm Giles Leeper. 2 Fridays ago, my family and we found ourselves in the city of Asheville in North Carolina, right when the remnants of Hurricane Helene swept through. They dropped huge amounts of water into the mountains of southern Appalachia. For those who don't know, Asheville is one of the biggest towns in North Carolina's Appalachian region. It's also the place where Sheila, my mother-in-law, and Willie and Sarah, my brother and sister-in-law, call home. And for any international listeners who might not be aware, Hurricane Helene has turned out to be one of the deadliest and most damaging hurricanes to hit the USA in my lifetime. As it passed by near us, it was just a tropical storm, and it was not immediately clear how disastrous it was going to become. The nearby creek bed was no longer big enough to fit that amount of water, and so we could see some mild flooding with our own eyes. And we had seen and heard some trees falling in the area, and so we knew it wasn't going to be good, but we didn't know how bad things were going to be, and we wanted to find out. But right at that moment, we were completely cut off from any communication. The electricity was the first thing to go. And of course, that knocked out all the Wi-Fi. And then the cell towers died, and that left us with no phone service. So no internet, no texting, no calling, no TV. And without that, we were plunged into a very peculiar and unusual state. The only way to find out new information was by talking to people face to face, in person. So at the moment when we were most confused and anxious and really wanted more information, the closest thing we had to an internet was walking outside and just talking to the people mingling in the street. In other words, it was exactly the same information channel that humans have relied on for 99.9% of human history, the word of mouth internet. And so that's what we did. We started having conversations with the people we saw. And that's what this episode is about. This episode is about our superpower and crisis. But I'm not focusing on the crisis caused by Hurricane Helene. I'm talking about a different crisis affecting the entire country. It's a crisis that is so big that the U.S. Surgeon General, Vivek Murthy, calls it the defining health crisis of our era. It's a crisis that he believes is caused in part by people not having enough conversations. I'm talking about the teen mental health crisis. If you heard the last episode, then maybe you can recall that there are many benefits to having simple conversations with children. We learned from Professor Rebecca Rolland that the line separating tutoring from conversation is actually pretty thin. In both of them, we use mind reading and scaffolding naturally. And both of them, tutoring and conversations, have many of the same benefits. The most practical and immediate benefit for me that day was just that I learned important information. I learned what other people knew about the developing disaster, about how other people were doing who lived nearby. I learned about past storms in Asheville and what those had led to. People shared what they knew about wind and saturated air in the mountains. But another benefit was that these conversations were good for my anxiety. They relaxed me. In a pretty dark moment, I found strength from just talking to people I didn't know. And I even felt a sense of belonging. Not really in the logical sense, because I don't belong to the community where I was talking. I guess I mean in more like a general sense, belonging as an emotion more than a logical state of being. Even when I would speak to people I passed on the street, after exchanging a few smiles and sharing our experiences, I felt a little sense of, I guess, human belonging. And the research clearly affirms my lived experience. Everything that is true for children is true for people of all ages. Here are some of the benefits of just talking to people. And I mean talking to almost anyone. Talking to people we're close to is important, but also talking to acquaintances is important too. And talking to complete strangers has really important benefits that have been well documented. Conversing can give us all a sense of belonging, and it combats loneliness. It improves our cognitive function, including memory, processing speed, and problem solving. For older people, regular conversations can slow and even reverse cognitive decline. People who engage in more conversations with strangers tend to become physically healthier in the long run. We learn things when we talk to people, we gain wisdom, and we learn to see the world more through another person's eyes. Perspective taking. A pattern of more conversations generally makes us more empathetic. What I felt most in that moment, I guess, was an increased sense of optimism and confidence about myself and the world in general. That's what made my anxiety go away. And that also was no fluke. Conversations improve people's confidence and optimism. That's the power of the humble conversation. And so it makes sense that when disaster strikes, people seem to naturally open up about talking, which is what I experienced that day. I felt like I could talk to anybody and have a good conversation. But there was one conversation that really stuck out for me that day. And actually, I wasn't even in this conversation. Eventually, Christina and I summoned the courage to drive our minivan through the new creek and the road and see what was going on outside of Sheila's little neighborhood. We saw damaged neighborhoods like never before. Trees and roads, on houses, power lines lying in the road, telephone poles flattened by trees. And when we went down near the Swannanoa River, we saw flooding. Flooding on the massive scale. Even then, we still didn't comprehend how bad things really were going to get. But it made everybody who saw it feel hollow and scared. And in the middle of all that, I saw something peculiar and uplifting for me. It was a group of 4 or 5 teenagers sitting on a rock, some were standing, and they were just talking. I happened to drive by in a moment of smiles and laughter. I was in my car, but I slowed down while trying not to be caught spying on them. But I was fascinated. I had never seen teenagers doing that before anywhere in that neighborhood in 15 years of going to Sheila's house on a regular basis. Never. I didn't even know teenagers lived there. But as I was driving away with them in my rearview mirror, it occurred to me that none of their phones were working. The internet was out. Social media had been replaced by going out your front door and talking to whoever's nearby. And amidst the mayhem of that day, they looked pretty happy. This stuck out, not only because of the contrast with the immediate crisis, but also it stood out in contrast with the youth mental health crisis, which is a crisis affecting every state in America and almost every developed country right now. Here's Surgeon General Vivek Murthy speaking on this topic.
I believe that mental health is the defining public health crisis of our time. And I believe that because our mental health really is the fuel that allows us to do everything else in our life. And what we are seeing, unfortunately, through stories and statistics, is that mental health is becoming an increasing challenge in our country, particularly for young people. There are a few numbers I like to keep in mind to remind me of how significant this is. One is the number 57. That's a % increase in the suicide rate among young people that we saw in the decade prior to the pandemic. And the pandemic poured fuel on the fire, so to speak, but the fire was already burning, prior to COVID-19 arriving. The other number that I keep in mind is the number 44%. That's a percentage of high school students who feel persistently sad or hopeless. And we think about high school should be a time where hopefully you're looking forward to the rest of life. That's not how nearly half of high school students feel. And the other number is 1 in 3. so about 33%. That is the number of young girls, of teenage girls in America who seriously consider taking their own life in 2021. That's an extraordinary number, and it should alarm all of us. What you see from all of this is that mental health struggles are common, and I suspect if the people who are listening today, if they pause for a moment and think about their own lives, they probably know a young person in their life who has been struggling with their mental health and well-being.
In April 2020, Dr. Murthy published a book called Together: The Healing Power of Human Connection in a Sometimes Lonely World. Dr. Murthy sees human connection, the kind of connection that comes from having real face-to-face conversations, the kind of connecting that I witnessed teenagers doing in the middle of this devastating crisis, as the primary path out of this youth mental health epidemic. How can conversation be an important part of our healthcare? Well, it helps to know what are the causes of this youth mental health crisis. According to the Surgeon General, there are many. Here he is again.
I think there are a few things to keep in mind. One is that young people right now, many of them are experiencing a disturbing amount of trauma and particularly violence in their life. Gun violence in particular has become the #1 cause of death among young people in America. You think about the children going through lockdown drills in school today who are wondering if this is the day something may happen to them.
Another factor is, of course, social media, for all the reasons you may have heard already. Online bullying, constantly comparing ourselves and our lives to other people and their lives. He says social media can even make kids feel worse about the friendships that they do have because they see pictures of their friends having fun without them at events that they weren't invited to. Social media makes most kids feel worse, and yet it has been crafted deliberately to be addictive to them. And those aren't the only problems with social media.
But I also worry about it stealing hours away from in-person interaction. And that's a real price that kids are paying. There really is no substitute for in-person interaction. Now, that doesn't mean that there's no place for online interaction. The danger becomes when we start to increasingly substitute the online interactions for what used to be offline, in-person interactions. And what we're finding right now is that the amount of time that kids, young people spend in person has decreased by 70% in the last 2 decades.
Did you hear that? 70%. A decrease of 70% is huge. 30% of what they used to be doing, face-to-face, in-person interaction. And this relates back to the main reason that Dr. Murthy wrote his book, Together. The youth mental health crisis is partly an epidemic of loneliness. Studies on loneliness tell us that 60 to 75% of adolescents, depending on the study, say they struggle with feelings of chronic loneliness. And it's worth noting that he had written that book before the COVID pandemic caused all of us to socially isolate. The pandemic only inflamed a loneliness epidemic that had already been growing since the early 1980s. So what does the U.S. Surgeon General think we should do about the defining health crisis of our era? And how have we done in the last 4 years since the book was published? Well, here are the 3 main components of Surgeon General Vivek Murthy's strategy to address the youth mental health crisis. The first is mental health services for our youth. Destigmatize asking for mental health support and make it more available, especially for the kids who need it most. And so, how are we doing on that? After 2020, mental health spending did increase, but mostly for adults. Right now, only 15% of children and adolescents are getting mental health services, which is, of course, only a fraction of the percent of kids who say that they are considering suicide, or that they're depressed, or that they're lonely. Over 22% of adults are getting services, which is higher than for kids, but even that, of course, doesn't address the real gap. The Surgeon General's second priority is combating loneliness, among other things by making schools places of more connectivity. Our communities all have schools in them. These are places where kids literally get together with other kids and adults in their communities 5 days out of the typical week. And so he'd like to see them become places of positive connection and inclusivity. He'd like to see cultures shift in these schools. How are we doing on that? The surveys aren't great. No research is telling us that teens feel more confidence rising and loneliness going away in schools. In fact, a Yale University study of 22,000 teenagers across all the states in America found that 3/4 of teenagers feel negative emotions most of the time at school on a minute-to-minute basis. The most common emotions that teenagers experience at school are boredom, anger, sadness, fear, and stress. In our community schools today, and Dr. Murthy's third priority is to combat loneliness and provide mental health services to parents. He notes that parents are actually more stressed now than they used to be. Not necessarily the highly educated parents. He's more worried about parents without a college degree. No matter their educational background, parents in the 20th century had a pretty good chance of doing better than their parents. But now, parents without a college degree are more likely to be doing worse than their parents did, than better financially, economically, or in terms of social status. And that is stressful and demoralizing. And yet those parents are, of course, the least likely to get any mental health services because those are expensive. Dr. Murthy would like to see that change. And so how are we doing? Well, during and after the pandemic, there was a big increase in the percent of adults seeking mental health counseling. But the group that increased reliance on mental health services the most was adults who had health care covered by their employer. It's more often the people with college degrees that have full benefits. They are the ones getting the most mental health support in a world that is more stressful for people without college degrees. And it's not just the parents who are suffering, of course. It is also their kids. Parenting is hard on mental health, and having poor mental health makes parenting harder. While no one is immune to this crisis, it is the children of parents without college degrees who are the most at risk of mental health problems, depression, suicide, drug overdose, anxiety, you name it. Not only do they have the most stressed out parents, but they also have the least access to mental health services when they need it. Dr. Murthy tries to sound optimistic in his book, but truthfully, 4 years later, it's not going very well. It has all the hallmarks of a vicious cycle, and I could easily see this getting worse over time. With less educated Americans struggling more and more, while the most educated Americans wonder, what's wrong with those people? Unless we try something different, maybe even something ridiculous.
Any useful statement about the future should at first seem ridiculous.
What would happen if we unleashed our superpower? All three of the Surgeon General's main priorities have everything to do with our superpower and the fact that it is still a privileged resource. Mental health services? Those are very often just experts and patients coming together to use their human superpower. A counselor or a therapist session is a conversation with mind reading and scaffolding, in which the hope is that the patient will both feel more confident and optimistic and learn something. That should sound familiar. What would happen if all children received some form of mental health coaching / tutoring in schools every day? Whether they are in crisis or not, they're going to face an incredibly complex world that will offer them all kinds of things to get addicted to, like social media, things that might be healthy if used one way, but potentially also unhealthy as well. Why wait until the child is depressed, lonely, and anxious to start counseling? How about we assume that our children all need our help instead? And what about combating loneliness? If children had a right to use their teaching and learning superpower all day and every day, would they still be lonely in our schools? Researchers have shown that the maximum number that can really participate in a true conversation is 5. 5 people. That's the maximum size that a meaningful conversation can have. Beyond 5, it becomes what psychology professor Nicholas Fay calls a serial monologue instead. And that's where the dominant people control the discussion, the shy people don't have that much influence. and it becomes more performative than conversational. The benefits I talked about in the beginning of this episode, the increased confidence, the feeling of belonging, those cognitive benefits, they don't happen in the same way in groups of 20 kids all at once. But they sure can when it's one teacher and 3 kids. That's a tutoring size group, but it's also a conversation group of 4 people. And with some intentionality, that is an opportunity to derive not only the benefits of tutoring, but also the benefits of its closest cousin, the humble conversation. What about the mental health of parents? Well, right now, schools do not usually educate parents as part of their core mission today. But every youth today is a potential future parent. By giving them the right to learn in the way that they learn best, both intellectually and emotionally, and also feel less lonely and anxious and depressed, we can hope that through our schools, we could have a long-term impact on generations in the future. And besides, maybe when we get deeper into the process of unleashing our superpower, at some point we might even rethink the idea that community schools should just be for kids. I know that sounds ridiculous, right? And that means it could happen. A future and more educated society will make decisions that we will find incomprehensible today. Right now, Asheville and other communities in North Carolina, Georgia, South Carolina, Florida, Tennessee are all coming together in beautiful and amazing ways to help one another through this crisis. Stories of heroism coming out of those areas are very inspiring, and they are plentiful. But that is also a predictable phase of a crisis. It's called the heroism phase. It lasts for about a month. The true test begins after the hero phase of a crisis is coming to an end. And that's where history has shown that the communities that will sustain their recovery resilience will be the ones that were already well connected before the hurricane. The ones with the bonds that run deep enough to last will rebound far better than those communities that were fractured, disconnected, and divided before the crisis. In the long run, they will be the least resilient. That's a metaphor for the rest of the society and our various crises to come. The fact that thousands of lonely children are feeling disconnected and dying of suicide and drug overdoses who weren't dying just 20 years ago in anything like those numbers is both tragic in itself, and it's also a canary in the coal mine, telling us that the fabric of our society is unraveling. In a complexifying world, keeping our superpower as a privilege to prop up some of us, but not the rest of us, is just not sustainable. In the long run, I think it's making all of us weaker. When the rising complexity of our society began to tear us apart during the Gilded Age, our communities responded with an unbelievable educational revolution, the incredible high school movement from 1900 to 1940. It's what the most successful societies have done when there was a wedge being driven between the more educated half of society and the less educated half of society. I think it's time to think about doing it again by unleashing our superpower. As always, thanks for listening, and you can find me at gilesleeper.com.